Why do dementia patients experience sundowning? Have you ever noticed that some dementia patients seem to become more confused or agitated as the day winds down? This phenomenon is known as sundowning, and it can be quite challenging for both patients and caregivers. Sundowning typically refers to a pattern of increased confusion, agitation, mood swings, and behavioral changes that often occur in the late afternoon and evening. While the exact cause of sundowning is not fully understood, researchers believe it stems from a mix of neurological, environmental, and physiological factors related to dementia. One important factor is the disruption of the brain's internal body clock, also known as the circadian rhythm. This rhythm helps regulate our sleep-wake cycles. In dementia, particularly in Alzheimer's disease, neurodegeneration can affect a specific area of the brain called the suprachiasmatic nucleus. This part of the brain is responsible for controlling circadian rhythms. When this area is impacted, it can lead to difficulties in regulating sleep and wakefulness. As daylight fades and evening approaches, patients may become more confused and restless. Another contributing factor is the decreased production of melatonin, a hormone that helps promote sleep. Lower levels of melatonin can lead to increased agitation and confusion during the evening hours. Environmental triggers also play a significant role in sundowning. For instance, reduced lighting in the late afternoon can create shadows and visual confusion, which may lead to hallucinations or feelings of paranoia. Additionally, fatigue from the day's activities, unfamiliar surroundings, and the stress sensed from caregivers can further worsen sundowning behaviors. Common symptoms of sundowning include agitation, irritability, anxiety, pacing, restlessness, repetitive questioning, hallucinations, and difficulty sleeping. These behaviors often intensify existing dementia symptoms rather than representing new ones. Managing sundowning involves addressing these underlying factors. Maintaining a consistent daily routine can help create a sense of stability. Ensuring adequate lighting in the evening can reduce shadows and confusion. It is also important to minimize fatigue by allowing 4 rest periods throughout the day. Creating a calm environment can further help in managing these challenging behaviors. Some interventions, such as bright light therapy and melatonin supplementation, have been explored to help regulate circadian rhythms. Behavioral strategies and caregiver support are also crucial in reducing distress for both patients and caregivers. In summary, sundowning arises primarily from disrupted circadian rhythms due to changes in the brain caused by dementia. These disruptions, combined with environmental and psychological triggers, lead to increased confusion and agitation in the late day and evening hours. Understanding these causes can help in managing the challenging behaviors associated with sundowning, ultimately improving the quality of life for dementia patients and their caregivers.